Welcome to Raaonline. I am Dr. Sudakshina, Professor of Anatomy. Today I am going to talk to you about the facial artery, the vein, the IJV and the EJV, and also the nerve supply of face. So coming to the portions as such, I will be starting with the internal jugular vein first and the related anatomy. Internal jugular vein can come as a clinical question. It can also come as a short note as such independently, and it is also a well-known question for MCQ. Internal jugular vein is one of the largest vein of the neck actually it is draining the blood from the brain, and it is one of the major vein of the head and neck region, and it will join with the subclavian vein to form the brachiocephalic trunk, and both the brachiocephalic trunks will be draining and forming the SVC or the superior vena cava. Internal jugular vein mainly receives blood from the brain, and it is a continuation of the sigmoid sinus, and it is also receiving blood from the face, thyroid gland, and also the neck region. It is going to come out or emerge from the cranial cavity through the jugular foramen. Now this jugular foramen is having a nervous component and a venous component. It is a pear-shaped foramen which is situated in the base of the skull, and this internal jugular vein is going to come out from this pear-shaped foramen and from the pars vasculosa of this jugular foramen, and it is just the continuation of the sigmoid sinus. When it is coming out from the internal jugular foramen, as it is a continuation of the sigmoid sinus and it is coming out, it is getting related to the middle ear cavity, and the middle ear cavity is just over here. So it is also related to the floor of the middle ear cavity, which is a very important relation which we have to remember. So this is the middle ear cavity. Okay. So once it is coming out and descending in the neck, first behind and lateral to the internal carotid artery inside the carotid sheath. So it comes down, and then as it goes down, it will be actually lateral to that of the you have the common carotid artery. So both the common carotid artery and the internal jugular vein and the vagus nerve will be present inside a sheath which is called the carotid sheath, and they will be traversing the neck totally vertically, and various triangles of the neck it will be crossing. So if you see, this is how it is traveling in the neck, and where it is originating, there is also a superior bulb. So there is a swelling or bulb because it's a continuation of the sigmoid sinus, and that is called the superior bulb of the internal jugular vein. And at its termination, where it joins the subclavian vein to form the brachiocephalic vein at the lesser supraclavicular triangle between the sternum and the clavicular heads of the sternocleidomastoid, that place also it is swollen up a little bit. There is a bulb which is called the inferior bulb of the internal jugular vein. So now it is definitely the largest vein of the neck. It begins as a direct continuation of sigmoid sinus. Sigmoid sinuses are sinuses which are continuing of the transverse sinus. So they continue as the sigmoid sinus and then the internal jugular. So transverse sinus continues as sigmoid sinus, and then it will continue as the IJV over here. So the IJV descends vertically in the carotid sheath. So very important, in the neck it descends vertically inside the carotid sheath. And the termination is very important. So where the vein begins and where it terminates at the sternal end of the clavicle by joining the subclavian vein, and this sternal end of the clavicle, it is actually falling in the lesser supraclavicular triangle, and it forms the brachiocephalic vein. So exactly here where it is terminating is between the two heads of the sternocleidomastoid. So we can approach this triangle. Through this triangle we can pass a catheter in the internal jugular through the internal jugular vein, and this kind of inferior bulb is about 2.5 centimeters above the medial end of the clavicle. So coming to the internal jugular vein as such, this has been showing the diagram. This diagram is showing the internal jugular vein formation. As I told you, this superior bulb of internal jugular vein, where it is exactly being formed or passing through the jugular foramen, that is related to the floor of the middle ear cavity. So that's why middle ear cavity is just above this. Then it coming vertically downwards, and then it is joining the right, this is the right side shown, so the corresponding subclavian vein, and it is forming the brachiocephalic trunk or the brachiocephalic vein, and both the brachiocephalic vein together will form the IV. Now there are some peculiarities which are associated with the internal jugular vein. We can see over here it is a continuation of a sinus, and it has the first tributary as the inferior petrosal sinus. So inferior petrosal sinus also drains blood. It is a dural venous sinus, and it will drain blood from the middle ear cavity, from the meninges, and from the posterior cranial fossa also. And its last tributary, if you can see that on the right side is the right lymphatic duct, and on the left side it is the thoracic duct. This is actually going to open at the junction where the jugular vein is opening into the adjoining the subclavian vein to form the brachiocephalic trunk. Exactly at that junction you will get this lymphatic trunks which are opening. So on the left side, the thoracic duct opens into the, and it is the last tributary of the internal jugular vein. On the right side, the right lymphatic duct is the last tributary of the internal jugular vein. There are other tributaries also of the internal jugular vein, as it is going to drain also the superficial tissues of the head and neck area. So the other tributaries are, you are seeing the occipital vein which comes posteriorly, and then anterior tributaries. So the tributaries which are coming anteriorly are the pharyngeal vein, the common facial vein which is also a very important tributary, then the lingual vein is also coming, and superior thyroid and middle thyroid vein. So superior and middle thyroid vein also are important tributaries bit of the internal jugular vein.